My name is Clayton Travis, Mental Health Policy Fellow for Texans Care for Children. There were two main themes for mental health and physical health coverage for Texas children this session. First is the implementation of the Affordable Care Act and the ever-broadening reach of managed care in the state's Medicaid program, and ensuring that transparency and consumer voice are represented within those implementation processes. Unfortunately, there was a lot left undone this session when it came to ensuring that every child has access to affordable health care coverage. The largest of which, our largest priority, was Medicaid expansion, which failed to pass this session, despite bipartisan support on either side of the aisle. HB 3791 by Representative Zerwas would have pulled down the federal monies allocated for Medicaid expansion to subsidize private health insurance through private healthcare markets. The bill made it through the House Appropriations Committee with bipartisan support, but unfortunately failed to make it to the House floor due to Senate, House, and executive leadership. Another important piece of federal health reform implementation that did not make it through this session is the ability for our Texas Department of Insurance to stop unnecessary rate hikes, health plan rate hikes. Currently, our Department of Insurance has the ability to deem these rate hikes excessive and unjustifiable to the consumer, but it has no power to actually stop them. I was especially fortunate to work with one mother who expressed that 2 of her 3 children were struggling with mental health concerns. She spoke so passionately about how the Medicaid program had helped them receive the medication and treatment they needed, and also how the program provided financial stability for the entire family. She spoke also about how one of her children had aged out of the Medicaid program and was currently still struggling to find treatment because the whole family is uninsured at the moment. She spoke also about how she was concerned about her youngest son, who eventually would have to age out of the program and may not be able to keep getting the treatment and medication that kept him thriving and functional in school. Once stories start to flood in about the advantages that other states are seeing as they fully implement the Affordable Care Act, such as uncompensated care cost reductions in uninsured individuals, Texans Care for Children will be very well positioned to make a case for full implementation of the Affordable Care Act, including Medicaid expansion in the 84th Texas legislative session. The Medicaid program has been going through substantial changes in the last couple bienniums. Nearly the entire program is run through managed care entities that are charged with coordinating the health of children within the program and also reducing costs. This affects the nearly 2.6 million children involved in the Medicaid program, and Texans Care for Children fought to include advocate and consumer voice in the implementation process of many managed care bills throughout the session. Limited providers within the Medicaid program is also an important issue for Texans Care for Children this session. It's important that we have enough providers within the Medicaid program so that children all across the state can receive the services that they need. SB 1150 helped to address this issue by creating a provider protection plan to reduce the administrative burden within our state's Medicaid managed care system, so that providers have a reduced reimbursement anxiety and they have more streamlined processes when trying to get children the services that they need. Additionally, there were some private coverage improvements for children living with autism this session. There is no longer a provision that health plans can stop providing autism services for children who age past the age of 10. Now that if that child is diagnosed before the age of 10, they can receive autism services for the rest of their life. Additionally, Texans Care for Children fought to mandate that health plans require autism screenings at ages 18 and 24 months so that children can get diagnosed early, get the early intervention that they need, and then which will then provide a more functional life from then on out.